Good evening, everyone. We are going to start the webinar shortly. We're just going to give it a couple minutes here to confirm that we've given all the attendees a chance to join. So if you can just patiently hold tight, we'll get it going here in a couple minutes. Thank you. Okay, good evening, everyone. Thank you for joining us on tonight's Talk with Doc. For those of you that don't know me, my name is Gavin Nelson. I'm the chair of the board of Northern Hearts. We're a local charity whose mission it is to decrease the incidence of cardiovascular disease in Northwestern Ontario, primarily through education and research. A couple housekeeping items before we start the webinar. First off, tonight's webinar is being recorded, so I do invite you to visit our website, www.northernhearts.org, where we will have a link for the playback following the presentation. Also, at the end of the presentation, we will have a Q&A session. So if you'd like to ask a question of our presenter, you can actually click on the Q&A dialog box at the bottom of the screen, where you can type in your question. Just given tonight's topic, I do ask you to try and keep it within the context of the presentation, because I know that there are many unanswered questions related to COVID, and I don't think our presenter will be able to provide insight on when things will get entirely back to normal or how many vaccines we're going to receive. So just please keep that in mind. So with that said, I think we'll go ahead and get going here. So Coronaphobia is the title of tonight's presentation, Minding Your Heart. We are very fortunate to have our presenter tonight, Dr. Meaghan Labine. Dr. Labine is from the small community of Red Lake, Ontario. She completed her Master's of Science in Medical Microbiology and PhD in Pharmacology and Therapeutics from the University of Manitoba. Her medical doctorate and family medicine residency training were completed through the Northern Ontario School of Medicine in 2018 and 2020, respectively. Dr. Labine has gone on to continue residence training in public health and preventative medicine program through the Northern Ontario School of Medicine in Thunder Bay, and is in her third year of the program. As you can see from her title, she is a very well-educated individual. So we are very fortunate to have her here. So I will pass it off to Dr. Labine, and thank you.
Beautiful. Thank you, Gavin. Thanks for the warm welcome. And it's fantastic. I can't see you, so mentally I'm going to have this picture of all these bobbing heads in the audience. So I'm hoping to take you through a bit of a journey on what is coronaphobia and how does it relate to your heart. And I'm going to try to keep this talk to about 30 to 40 minutes, and I'm hopefully going to have it a bit interactive, but we're going to be limited on time. So at the end of the talk, we can take up some of the polls that are going to be distributed throughout the talk, and hopefully get some insight into how you're doing with all of this. So without further ado, let's delve into it. Oh, sorry, I'm running into a bit of technical difficulties on. There we go. All right, so overview of the talk today. So I'm going to take you through what is COVID information overload, and leading into phobias, what is coronaphobia and how does this information translate into stress? And then essentially, what is stress and how does that stress impact the body and eventually lead to impacts on your heart? I know for all of you, you're probably here because you have some issues with heart disease in the past or currently, but you may not all have a good working understanding of what that really means. So I'm going to give you a little bit of that understanding and then walk you through some elements that you can use to address coronaphobia and hopefully reduce some of the stress that are coming with it so that you can alleviate impacts to your heart and improve heart health. So to kick this off, I'd like to start with some awesome words. In this pandemic world, we've been flooded with way too many. And here's some very familiar ones that you may all recognize. So quarantine, self-isolation, isolation, stay at home, curfew. I mean, curfew is kind of nice. It brings you back to your adolescent days, and hopefully it doesn't go back to too far. But so to give you an idea, what's the difference between all of these? Because part of this presentation is going to be about giving you the information so that you're better educated to be able to reduce some of the fear and anxiety that comes with the information that you're getting so that you can alleviate some of this. So overall, what quarantine means is that essentially it's to separate and restrict movement of people who are exposed to a contagious disease and to see if they eventually become sick. So an example of this is you're in the grocery store, you've come into close contact with somebody, they tell you, you got to stay at home in quarantine. We don't know if you're sick yet, but you got to wait the 2 weeks. Self-isolation, on the other hand, is where you separate the healthy from the sick. So if you're sick, you self-isolate until your symptoms resolve and your tests come back negative. Isolation is essentially the same thing. You're just staying at home alone. And that can be either singularly or joint. And then stay at home, which is what we're all currently under, is the stay at home orders, which essentially restrict unnecessary travel. And I don't mean recreational travel to your favorite tropical getaway, although currently that doesn't seem to prevent anybody, but it's more so to restrict your daily movements. And then curfew is looking at the time limits of when you should be at home. Now, to take you to what a pandemic is relating more to kind of an epidemiological distribution of disease. And what that means is a geographical distribution of where you have infected people. So endemic is, if you look at this little picture I have here, endemic, further to the left side of the screen, is when you have disease cases that are typically within the population, but they occur at regular rates. An epidemic is when you have increases in disease within a particular geographic region, and you get a sudden rise in those numbers, but it doesn't typically spread from continent to continent. Pandemic is where you get more of a worldwide spread of a new disease or strain of something that has been previously present, for which the world doesn't have immunity to. So, and we've had quite a few scares of this in the past. If you recall, H1N1, everybody's quite familiar with the Spanish influenza. But right now where we are is in a pandemic. And now to take this to an infodemic, which up until COVID, this word didn't even exist. An infodemic describes this deluge of information that we're being exposed to 24/7. And it includes factual and mis or disinformation. So essentially it's abundance. And why this is interesting, particularly now with COVID, is this is the first time in history that we've had social media and technology help to inform us during the course of a pandemic, to not only keep us informed and connected, but help to keep us safe and sometimes unsafe. In addition to this, with our transition to this online lifestyle, it's allowed us to work and socialize while we're isolated. But again, because of it, we have this unending information about COVID and kind of the daily life that takes place within our new normal. One of the other interesting facts that comes up with it is that in addition to factual information, we're also exposed to mis or disinformation. And although it's good to have discussion and contrary views and something that challenges us, it can also lead to confusion and a lot of distrust in government and in our own sense of self to some respect, because we have too much information and it becomes difficult to tease apart what's true, untrue, and we get overwhelmed. So amongst this, it becomes difficult to know what's relevant. And what was relevant yesterday may not be relevant today, even if it's true. So here's a poll question for you. I want to just think about this for a second. How many hours a day do you spend looking at COVID-related material? Is it 30 minutes, an hour, 2 hours, more than 2 hours? You can add your thoughts to the chat box, or when it comes to question time, we can get an idea of how much time you actually spend. But this is an exercise for you just to reflect back on how much time do you actually spend. And it's not usually until you're asked these questions that you have an appreciation of how much time you spend. So moving right along. The reason, I might have skipped a slide here. No. So why do I bring this all up? There's a very important concept called health literacy. And we're all familiar with what literacy is, which is the ability to read, write, and understand numbers, which is considered numeracy. But health literacy is when you take your ability to read and write and you apply it to a health context. So how well do you know health information? So I'll give you a question here. And again, just think about this. What's the difference between high blood pressure and hypertension? So you've gone to your doctor and your doctor says, you've got hypertension, we need to treat it. And at home, you're thinking, well, I've got high blood pressure and I can, feel the headache raging in my head. I don't feel quite well, but why were we talking about hypertension? So think on this. And again, you don't have to put it in the chat that you don't know, but essentially the answer to the question is they're the exact same thing. And it comes down to semantics, high blood pressure versus hypertension. But as we all know, when you go into a physician's office or when you're reading different types of literature, they can use different words to mean the same thing and sometimes more complex words. And if you don't know what's being spoken, it's hard to appreciate and execute the direction or even medications that you've been given. So according to the Public Health Agency of Canada, about 60% of adult Canadians are not health literate. So they have difficulty understanding medical related health information. And that's kind of scary because thinking about this, how many times do you go to the physician's office or even just pick up a pamphlet, and you have to be able to pick out information and apply it to your own health or the health of loved ones and have an appreciation of what that means? Factors that can as you can see, COVID has infected my brain. Factors that affect health literacy are things like age, education, job, your overall health. And I mean, there's many more, but this is just to give you an appreciation. What I'm trying to draw your attention to is as we reflect back on COVID information, because it's very dense in the type and breadth of material that we're talking about, if you're having difficulties with basic health literacy, you can imagine how much more difficult it becomes to wade through the vast amounts of material that we're being dealt with or being dealt with COVID if you have difficulties with kind of some of the more basic premises. And the pictures that I have up here in the corner, this is a blood pressure cuff on the side that physicians use to check blood pressure. And this is a stethoscope. So also important things to know, because when you're getting your blood pressure checked at the office, that's what they're using. So we already chatted about why this is important, but ultimately it brings it back to, if you don't understand the information, it creates this sense of vulnerability, feeling threatened, and you start to panic. And these sensations can lead to uncertainty, fear, anxiety, and essentially create even more of a divide between yourself and this information ocean that we're dealing with. So here's another question for you. How comfortable do you feel about talking and understanding medical information, particularly with your healthcare provider? And this is maybe the first time that somebody's asked you this, but just think back. How many times have you left the doctor's office being like, what the hell did we just talk about? And you don't have a clue of any of the instructions. So be honest with yourself. So number one, scares the hell out of me to talk about. I don't read the forms, I just sign them. And you may laugh, but this happens quite often. I know I have a heart, but not sure where it is. And here's a little tip. It's on the left-hand side. I'm okay with the basics, and let's talk shop. So you don't feel bad. Even a lot of physicians, when they come to the doctor's office, they prefer when we just talk plain English. Because everybody's human, there's limitations to our knowledge and understanding. And when you're sick and not in your best frame of mind, it becomes difficult, no matter your baseline intellectual level, to understand and grasp and apply some of these more complex medical concepts. So regardless of your current ability, what I encourage you to do is just ask questions. Empower yourself to say, could you make that more simple? How do I take these medications? And what do you mean by that? So if you don't ask questions, at the end of the day, it's your own fault for not trying to get educated, because nobody really knows how much or little you know except you. Now, to bring this all back to mental health, because essentially coronaphobia is a concept that relates to mental health. So what are phobias, first off? So phobias are a group of conditions that fall into an anxiety disorder. And anxiety disorders are characterized by this persistent, excessive, or unrealistic fear of an object, person, animal, activity, situation, essentially anything that leads you to have an avoidance type behavior that leads to functional impairment. So when you have a fear of something, if you can't avoid that fear and the trigger that causes that fear, it leads to anxiety, distress, and depression. Now that takes us into coronaphobia. So Chronophobia is essentially the fear of contracting COVID, leading to functional impairment of your daily activities. And what I mean by functional impairment is that your typical activities in a day of going grocery shopping, out for a walk, communicating with people, you can't do it, even sometimes to do your job. So in this case, you have an extreme avoidance of people who have either contracted the virus or you suspect to have it, whether you have proof or not, leading to increased social or occupational stress. And this little picture on the left, you may be all very familiar with, of trying to shop in our new COVID era. And oh, what do you know? You see the light at the end of the tunnel, you're going to make a B for the door, and there's one of those bloody arrows that says you're going the wrong way. And I know what you're all thinking. You think, I've got my mask on, my hood up, your rock star glasses on, and you're going to make an incognito run for it. Blow this popsicle stand and get out. But at the end of the day, or at the end of your shopping trip, your level of stress goes through the roof. Not fun. I used to love grocery shopping until COVID, and now I love Instacart. So hopefully in our post-COVID era, we can get back to some normalcy. But coming back to this, how do you compare to the rest of other Canadians? You know, is your fear warranted? Or do you just have do you think that your level of concern for COVID matches those of other people? So there was a study done by the Angus Reid Institute, and they released a report back in February 2020, which essentially asked Canadians this same question. So they polled about 1,300 Canadians who were all adults, and they asked pretty simple questions. So what are you concerned about? And is it people all over the world becoming sick, people becoming sick in your community, friends or family becoming sick, or you personally? And 30% of respondents indicated that they had a significant fear or anxiety of themselves becoming sick. So that, to break it down for you, that's 1 in every 3 people having considerable concerns. And I provide a link at the end of this talk to get access to the remainder of this report. And you can even Google it yourself. It's free online. They have some other charts and interesting insights into people's overall concerns with COVID. So bring it back to chronophobia. What are the signs, triggers, risk factors for this? How do you know that you've got it? I mean, it's hard enough to know that you've got COVID. How do you know that you've got chronophobia? Because it seems like everything's infectious these days. You can't just sterilize your hands and wash it away and mask up to prevent it. So the symptoms of it are, as I mentioned already, there's anxiety, fear, depression, avoidance type behavior, increased stress, trying to seek safety. The triggers can actually be anything. And this makes, I think, this creates more of the issue with it because you can't avoid it. So the triggers are meeting people, leaving your home, travel, even getting your news updates, falling ill, going to work. The risk factors. So what I mean by risk factors are the things that put you at risk of becoming more likely to have this outcome. And these can be health issues for the simple reason that if you have poor health, so for example, if you've got terrible respiratory conditions or bad heart conditions, for example, it can make you more susceptible to other illnesses. If you've got vulnerable loved ones, so for example, parents in a long-term care facility, or you've got young children, your occupation, if you're a healthcare worker, or if you have to travel significantly, all of these will not only increase your risk of contracting COVID, but potentially increase your anxiety of contracting it. And just a quick note, I was going to start off this presentation with some of those flashy news updates that we typically get on a daily basis. But I thought, I'm going to bypass that. I think we are inundated with them enough, but all of them give you an example of how much fear mongering I think we're typically exposed to because we don't have a lot of the information, and information is changing so quickly. So how do we arrive at chronophobia? Does it just happen overnight? Is it just kind of a random like Russian roulette? Who gets this? And it's not just by chance. It's really a combination of many things. So there's, as I mentioned, the risk factors, so external risk factors. There's psychological processes that happen, and these two will kind of work together and agitate to create coronaphobia. So the external risk factors can be this unforeseen reality, so the new normal, unending uncertainty, avoidance behavior, new social practices, such as wearing masks and staying 6 feet away from everybody, loss of faith in health and government and infrastructure, and leaders and celebrities contracting COVID, international statements, and this infodemia or the infodemic that we're dealing with. Now, the psychological processes that happen would be things like interference with your routine daily activities, social amplification of risk, or this catastrophic interpretation. And all of these can be influenced by many other things, but this is just to give you a more succinct explanation. So the combination of these can have a tendency to lead towards the fear of contracting COVID. And to give you a bit more information on this, and if you notice on my slide, there's SARS-CoV-2 causing COVID-19. I think this bears emphasis because SARS-CoV-2 is the virus. COVID-19 is the disease that you get from contracting SARS-CoV-2, which is the virus. It's akin to HIV and AIDS. HIV is the virus. Once you contract that virus and it starts to weaken your immune system, then you develop AIDS, which is the autoimmune deficiency syndrome. So I digress a little bit, but coming back to coronaphobia, once you do have it, what does it even look like? So there's physiologic outcomes, so concern for symptoms. You can have cognitive changes, which is the fear, anxiety, or depression, and then the behavioral changes. So we talked about the avoidance, safety seeking, and needing reassurance. And ultimately, all of these can funnel down into a more unique or succinct package of stress. And we all talk about stress every day, all day, or we think about it to some extent. But what is it? And it's a unique experience for each person. But essentially, stress is the silent destroyer. To make it more simple, it's a response by the brain and body to any type of demand or challenge that you have. So this can be from work, school, trauma, really anything, traffic, going to the grocery store. But to emphasize, stress is a very normal reaction. We actually need stress. And there's different types of it. There's major or minor forms, otherwise known as acute versus chronic forms. And I'll get later on into the distinction between acute and chronic. And it affects everybody to different degrees and in different ways. So one person's stress is not somebody else's, but just because we express it in different ways doesn't mean we're not all experiencing it. We just have different ways of managing it. There's also good and bad stress. So good stress, for example, is helping me to deliver this talk. It jacks up my stress hormones, my sympathetic nervous system gets activated, and I'm able to be more energetic and engaged during this talk. So that's a form of good stress. Bad stress, however, is something that is accumulated over time and weakens you because you just get worn down. And all of this translates into various mental and physical responses. And ultimately, stress is cumulative. So you may think that, after having years of a stressful lifestyle, and then one day you retire and you're able to just sit and relax and watch the game with a couple beers at the end of the day, don't think that you are stress-free at that point, because you've still got years of accumulated stress that you still have to deal with. In fact, going back to my research days, it was interesting. We came across a study that showed that 6 months of stress led to years worth of accumulated damage. So that's something to keep in mind, that never pass it off as being insignificant. Stress is a real thing. And we're now in the medical community starting to find ways of talking about it and addressing it with our patients. So to get, I guess, more into the nitty-gritty of how it affects us, because one of the things I'm trying to achieve with this talk isn't just to bore you, because you can probably take melatonin and have a drink after this and have a great night's sleep. But I'm trying to educate and empower you to have an understanding and hopefully take away some of the mystery of what's happening, not only externally in this COVID world, but internally within yourself. And usually, once we have a bit more information and we're comfortable with it, it inadvertently creates a degree of calmness because we have a sense of control. And all of us are control freaks to varying degrees. So hopefully I'm speaking to your inner control freak. But I know this page is a bit overwhelming, so I'm going to walk you through it. So this is looking at the physical and neurochemical processes that we use to adapt to stress, because stress is something that happens to us all, and our mind and body have to work with these incoming information and responses in order to adapt. So if we start off in the left-hand corner, this is us, this is the individual. And all of us are different based off of our genes, developmental processes, our experiences. And as we go through life, we have different stressors that we're exposed to. So that could be environmental, so your work, home, things in your neighborhood, major life events like the death of a loved one, trauma or abuse. And these all funnel in to give you perceived stress. And stress, as I mentioned, can be seen as a variety of different things. What that then leads to is your behavioral response. One of them being your flight or fight response. There we go. And this is usually a response of the activation of your sympathetic nervous system. And don't get too lost in, what is a sympathetic nervous system or what's even the nervous system. It's more so that your body is geared to activate. If the bear is coming towards you, do you run or do you cower? And that's all your body is trying to prep you for. So within all of this, you have your physiologic responses. And your physiologic responses just means your body's response. And that can be anything from how you think, how you digest, how you perceive, even how your pupils dilate. So within this physiologic response, you have something called allostasis. And that just means the process by which the body responds to stressors in order to maintain homeostasis. And homeostasis is a fancy word for balance. It means that, you can stand on your left foot or your right foot. Either way, your head is still on this side of the ground, but you've got balance. Now, when you're exposed to stress and all these physiologic responses are trying to take you out of balance, that's called adaptation. And adaptation allows you to respond and either accentuate or decrease certain aspects of yourself in order to bring you back to balance. Now, what comes out of this is something called an allostatic load. And allostatic load is the wear and tear on the body which accumulates as an individual is exposed to repeated or chronic stress. It would be, I'm trying to think of a good example here. It's kind of what you'd have in response to exercise. If you hit the gym every day, you notice bodily changes, i.e. your body's adapting. But even though you're exercising every day, you still feel wear and tear. Your joints get a little bit achy, maybe your ankles hurt. But essentially, as we look back in its relationship to stress, that allostatic load from stress translates into things like changes in digestion, decreased libido or changes in your interpersonal relationships, altered bone density, changes in immunity, cognitive changes, so how you think, and then changes to how your heart functions or factors that impact your heart. All right, so as promised, what are the types of stress? There's acute and chronic. Now, what do I mean by that? So acute is something that's very short-lived. Chronic, on the other hand, is on a much longer term. To have more an exact definition, so acute is something lasting usually less than a week. And in terms of stress, we use a week just kind of arbitrarily to give us a metric of how to understand it. versus chronic, which is stress that's lasting more than a week. Now with acute, it can be from specific or unique events that are typically unpredictable and they put you on the spot. So for example, you get into a car accident. Yeah, that's stressful. The stress response helps you to deal with the situation at hand, so it's perceived as positive. And this is kind of going back to some of the concepts that we've previously chatted about good and bad stress, this fight or flight response. Good stress helps you activate and respond to stressful situations. You get into that car accident, you jump out, you lift the car off of the jerk who was texting and hit you from behind, but you still lifted the car off him. Good for you. You're a hero. Thank you, acute stress. However, if you have an underlying heart condition, that acute stress, because you've got changes to your heart rate, your blood pressure is raging and it's high, and you've got this incredible Hulk type mentality, yeah, it can be hard on your heart. I think, oh no, I was going to say Lou Ferrigno, the gentleman that played the Incredible Hulk. I'm not sure if any of you are familiar. I thought he may have died of a heart attack, but maybe not true. So don't quote me on that. All my years of education, and I don't know Lou Ferrigno's autobiography. All right, getting back to it. So for chronic stress, this is lasting more than a week. And when it's chronic stress, you have repeated exposures to stressors, and these stressors can be seemingly benign. So you go to work and every day your coworkers are razzing you about something or your boss is picking on you. Yeah, you can shrug it off, but over time it accumulates. And because they accumulate, your stress responses become chronically activated and they can become exhausted, which leads to a negative stress response. And over time, because of this accumulation, it can contribute to the development of heart disease and a breakdown of other bodily symptoms. Because as I mentioned, stress is cumulative. And what I mean by cumulative is that it adds up over time. So just because you have one good day in a week, Sunday, nobody's bugging you, doesn't mean that the other 6 days of very stressful living are all of a sudden abolished. They're not. Hopefully some of this is resonating with you, because now we're going to get into the meat of the conversation. So what's the relationship between psychological stress and the heart? And there's actually two main ones that I'm going to review in this talk. So there's the direct and indirect. Direct means more of the physiological or bodily changes that would lead to changes in heart function. So this is hypertension, aka high blood pressure, elevated heart rate, elevated cholesterol, elevated neurological stress, so just mental stress, increased cortisol and adrenaline. So cortisol and adrenaline are the two of the key stress hormones that your body produces in response to stress. And a neat little thing that you can do is if you take your hand and you make a fist. I don't know if you guys can see my fist, but if you make a fist and you clench it, this is actually the size of your heart. And if you want to get an appreciation of how a heart functions, you can, maybe you're all doing this at home, maybe you're not, but you can start to slowly just open and close and squeeze your fist. And the faster you squeeze it, the more difficult it becomes to achieve a regular rhythm. And that's what happens with certain things like elevated heart rate. So yeah, it seems like it's not so much of a big deal until you start to get a visual of how those changes in rhythm affect your heart. So taking us back to the indirect. So indirect is more things related to behavior. So this would be lack of exercise, stress eating, which, as you all know, potato chip sales have gone through the roof with COVID. I'm sure none of you have had that happen to you. You've all been very good with your carrots and celery. Failure to see a doctor because of people fearing of contracting COVID, non-compliance with medications, and excess social media and news. There we go. So to have a good idea of the types of heart disease and bringing me back to improving your health literacy, I wanted to give you an idea of what major types of heart disease and even what it looks like. Because when you go to your doctor, we have a really bad habit of talking about these big concepts with you, but failing to recognize that in order for us to talk to you about these big concepts, we've had to go to school for almost 9+ years. So that's our undergrad, medical school, and then our specialty. So the two major types that I'm going to talk to you about, there are many types, but two of the major ones, first one being congestive heart failure. So this picture here is a cross-section of a heart. And the heart is largely a big muscle. It just contracts all day, every day, because if it doesn't, you're dead. So taking us back, your heart is all muscle, and it's a very efficient muscle. To break down what congestive heart failure is where the heart muscle fails to contract. So it's all of this bulky tissue here, all of a sudden can't do its job. The congestion part comes from the fact that the heart is really just a big pump. It's a water pump, and it moves the fluid around in your body. One side pushes it away from the heart, and because it creates a positive and negative pressure, it allows for fluid to come to the other side of the heart. So this side of the heart will push fluid out, and this side of the heart will pull fluid in. Now, with congestion, when your heart muscle starts to fail, that fluid will not flow as efficiently, and it'll start to build up. So you get congestion, so fluid buildup within areas like your heart or in your lower legs, which leads to swelling, otherwise known as edema, or you can get it in your lungs, so something known as pulmonary congestion. Why you get congestive heart failure? It can happen due to a variety of things. Things like a heart attack, for example, where the blood supply to the muscle of your heart fails to deliver oxygen, so your heart tissue dies. And I'll get into that when I talk about coronary artery disease. Other things that can cause it are the flaps here. So these are your valves of your heart, which are one-way valves, where they fail and they prevent one-way movement of fluid, so you get fluid backup. Now, taking it to coronary artery disease, which I already alluded to, your heart, it's a muscle. We know this. Muscle needs blood. Why it needs blood is because blood is rich in oxygen. Without oxygen, your body cannot make the energy molecules required for your cells to conduct its regular everyday activities. So these blue little veiny things that I'm outlining here, these are called your coronary arteries. Coronary is just a fancy name for heart. So when you get things like high cholesterol, these coronary arteries can get blocked, which blocks the blood flow to the bulky muscle tissue of your heart. And I'm trying to see if I can get back. No, I wanted to give you another view of this heart here. I think I'm not going to be able to show you. So at the start of this slide, the heart actually spun around, but you have coronary arteries that surround your entire heart. Essentially, once you get blockage of blood flow to any area of your heart, because you have blockage, you can't get oxygenated blood. And without that, that tissue of the heart dies. And that can lead to a heart attack, which inadvertently can lead to death of the muscle tissue and cause things like congestive heart failure. So hopefully that wasn't too much of a complicated explanation. Oh, there we go. Now you can see it twirling around there. Little ballerina move for you. Okay, so back to the stress response. I know it's very complicated and you're probably getting exhausted just hearing me talk about it. I'm going to make this brief, I promise. So the stress response, we can look at it from another way. I talked to you briefly about adrenaline and cortisol, and these are important because they can lead to a lot of the long-term changes that you see in response to stress. So how it typically happens, I'll try to make a complex process very succinct, i.e. simple. You have something called your hypothalamic pituitary axis. So these are two areas of your brain that responds to changes in your body. And what they signal is for the body to produce different types of either neurotransmitters, which are brain chemical, or different types of hormones. And there's a whole variety of things that they do, but for simplicity's sake, we'll leave it at that for now. So your hypothalamus will stimulate your pituitary gland. Your pituitary will secrete a certain type of hormone, and that hormone will stimulate the release of adrenaline and cortisol. And you'll get the release of adrenaline and cortisol when you have increased stress that your body is trying to deal with, because the adrenaline and cortisol gives your body the adaptive power to respond to it. Now, that adrenaline leads to faster breathing. It changes your liver to be able to pump a whole pile of sugar into your bloodstream for immediate energy. It increases your blood pressure. So your heart is starting to beat faster and push blood quicker. So your muscles have more oxygen and energy so that they can activate and run. It changes your vision. You get accelerated heart rate. But to look at it more closely, these things can also change your sleep, lead to increased inflammation, and activate your sympathetic nervous system, which impacts your heart. So essentially, when you're looking at chronic stress, it builds upon what you've already got. So chronic stress brings us close to the edge of a cliff, and our predispositions, such as genetics, lifestyle, mental health, can push us over the edge and cause a bulldozer effect. So how do we overcome coronaphobia? Essentially, it comes down to stress management. So here's you, and you're exposed to never-ending COVID information. You can do your best to block it out, you can mask, but essentially that information is still going to get through, and you have to process it. So you now have a choice. You can become overwhelmed, or the light bulb can go off. And you can recognize that to some degree, you have control over your mind. So stress and anxiety, depression, they're all normal responses, but to an abnormal situation. So the question now becomes, what are you going to do about it? Bringing us back to this infodemic management concept is we can't escape the information that's being exposed or that we're being exposed to, but we can learn how to manage it. So that would be through our cell phones, computers, print news, pretty much anything where information is coming through. And we can have a way of minding our media. And what do I mean by this? So you want to find credible information, balance your intake, and intentionally unplug at the end of the day. So you should never be plugged into your cell phone or computer 24/7. It's not good for you. We weren't designed that way. But to take it back a little bit about the credible information, I'm sure you all recall the ideas of treating COVID with guzzling bleach and potentially doing a line or two of cocaine. Sounds like a crazy weekend. But I oftentimes wonder, whatever happened to keep the doctor away with a simple apple? Maybe if you throw it at them, but not in today's age. But moving along. So what are some other means of heart healthy stress reduction? So the first one is menu. And I was tempted to put diet, and that was my first word, but there's too many negative connotations with it. And I'm a pretty hardcore foodie. I love food. I enjoy all of it. But you don't have to strictly eat salads every day of your life and cut out such a rich experience from your daily activity. You just have to start being mindful about it and finding ways of enjoying it and getting back to what it actually means to eat mindfully and joyfully and start cooking at home and making it more of a social experience. Hopefully you'll get to the point that when somebody offers you a Big Mac, the thought will go through your head of enjoying, but eventually you'll decline the temptation and you won't contaminate your tongue or your body with that swill. The next major thing is exercise. So did you know that 30 minutes a day of just moderate activity, you don't have to be a CrossFitter, can be as effective at reducing stress, anxiety, depression as an antidepressant? It can release just as much serotonin and dopamine as certain medications. And it has a lot less side effects too. The side effects are usually better fitness, better sleep. But essentially, all I'm saying is go out for a 30-minute walk and make it an enjoyable activity. Meditation. That's another excellent way. Now, when I say this, it doesn't necessarily have to have a spiritual connotation. It can be something as just breathing in and out for 5 to 15 minutes daily, but being mindful about it. And what I mean by that is putting focus into it and having your mind completely in the present. The next is investing in sleep. You need sleep. Sleep is equivalent to if you could imagine a big high rise building, and during the day you have high powered executives working tirelessly to make big, complicated deals. And at night, once everybody goes home, the janitorial staff, the maintenance crew comes in, they clean up, they make the building functional and clean for the next day's activities. That's what happens when you sleep. It's your brain and body's opportunity to clean up and repair. And without it, you start to turn into a bit of a mess. Follow up with some routine medical visits. Despite COVID happening, everything else is still in play. So just because COVID is in existence doesn't mean that people stop having heart attacks or getting sick. It just means we have to change the dialogue. So make sure to follow up. Next is controlling your vices. And don't get me wrong. I mean, I'm by no means a saint, and I'm all for picking up new hobbies. You may have all noticed recently in the news, meth is on an all-time high. No pun intended. But make sure to not overindulge. So you don't have to be a saint. You don't have to completely exercise abstinence, but you have to do so with some recognition that you can't overindulge, because then it'll start owning you as opposed to you owning it. In fact, the recommendations for alcohol consumption for men and women, so 14 drinks per week for men, otherwise 2 per day, and for women it's 10 drinks per week, or roughly 1 to 2 per day. I know there's a big difference between men and women, but these are just the recommendations. I don't make them, I just tell it to you. Ultimately, what I'm trying to say to you is that with all of these heart healthy stress reduction recommendations, is you have to find a way to tailor it to yourself and put an emphasis on doing it today. Don't put off what you can do today tomorrow, because essentially tomorrow never gets here. And how do you do this? So you make yourself the priority. You are 100% responsible for yourself. Find what makes you happy, because you won't maintain anything that you don't enjoy doing, especially if you're already stressed out. Make it easy and fun, especially when you're setting goals. If it's not easy, first off, you won't maintain it. But if it's fun, you'll actually look forward to doing it and set aside time. And I know I've mentioned being mindful quite a few times, but mindful is about being present in the moment. And with all of this, you create structure so that you ensure that you do it on a daily basis or every other day. And you don't have to do all of it. You just have to pick 1 or 2 things, make it enjoyable. And then over time, you start to notice the beneficial effects. So to give you an idea of what I like to do, I have a dance party for one. You should see my basement. It's incredible. I've got a pretty crazy sound system and some excellent laser lights. I mean, it drives my neighbors crazy, but I don't care. And I dance my face off whenever possible. So another part of all of this is humans are social creatures, but how do you responsibly socialize during a pandemic? I mean, you could follow step with Baby Yoda. However, most people nowadays are pursuing social media as a means to maintain social connection. And I'd say do so cautiously. Their science, and I know everybody science says, but whose science? Baby Yoda is going to be science for tonight. There's actually a direct association between increased social media use and increased depression. Because I hate to break it to you, all of your Facebook and Twitter followers aren't actual friends. A friend is somebody that will pick you up from the airport at 3 a.m. in the morning. So larger in number are we, but smaller in mind. Wiser words were never spoken. We have to find alternate ways of creating this social connection while still maintaining our mental health in and amongst a pandemic. How do you do that? So there's Zoom dates. I mean, we're having one now and it's quite lovely. There's phone calls. I know it's outdated tech, but give it a try. Going for a walk. You'd be surprised at how therapeutic just going for a walk through the bush and smiling at a complete stranger can be. And there's always having a small group of friends. So you can do so still within this COVID world. Just make sure you're playing safe. And then a word on surviving versus thriving. And we all talk about these concepts of how are you coping? There's a difference between coping and resilience. Coping talks about methods to resolve or minimize stress versus resilience is having the ability to overcome adversity and essentially just bounce back. Coping is kind of these ongoing mental and physical activities to dissolve it. So it's essentially going for a run or, sitting and watching your favorite show. But when you look at it, developing strong coping skills is actually helps you to become resilient, but one doesn't equate the other. As I mentioned, resiliency is having the ability to adapt to adversity and recover. And it exists when a person uses mental processes and behaviors to promote their personal health and negate the effects of stress. So the greater your resiliency, the greater your ability to withstand adversity. And ultimately, if you're feeling overwhelmed, you need to ask for help. I couldn't have a talk like this without making this plug. If you feel overwhelmed, talk to somebody. There are quite a few resources, doctors, counselors, friends, mental health hotlines, and recognize when you're at risk. So risky behaviors, suicidal thoughts, extreme emotional distress, increased alcohol or drug use. And remember, it's absolutely normal to feel alone and stressed, but you don't have to do it in isolation. You don't have to do it alone. So here's another poll for you. What is the one thing that you'll change to improve your mental health and in turn your heart health after you've seen this talk? So just a quick summary, Coronaphobia is a real phenomena where people fear contracting COVID-19. It's essentially fear and anxiety resulting from, or the fear and anxiety resulting from coronaphobia can cause increased physiological stress, leading to mental and physical impairment that can affect your functional activities and become maladaptive and impact your heart through things like increased blood pressure, heart irregularities, and other maladaptations. And there's within that many positive ways that you can reduce this stress to become more resilient and thrive in a time of the pandemic. And remember to always ask for help when you need it, and that at the end of the day, you're human. And like the rest of us, no one is immune to the human condition. All you got to do is your best. So I want to conclude by saying thank you to everybody who's attended. Oh, that jumped the gun a little bit. And some final thoughts for you. So if you change your mind, you can change your world. Show that you have gratitude and focus on what you have as opposed to what you don't have. And I'm usually more of a glass full kind of gal. And I'd like to think that there's always a silver lining. So in the event of a hostile Martian takeover, we now have the ultimate defense. Sorry, Martians, the Earth is closed for intergalactic travel. So hopefully none of you were planning on going off to the moon, but maybe you'll have some great Z's tonight after watching this presentation. So I just wanted to acknowledge the Northern Hearts program for inviting me to give this talk. I wish you guys all the best. And here's some additional resources if you want to do a little bit more reading and invest in your mental and heart health. And there's some references where to get additional information. As mentioned, this talk will be posted online, and it doesn't look like we have too much time for questions, but I'll leave it up to Gavin to open it up. Thank you, everybody.
Thank you very much, Dr. Labine. Sorry, my sticky note. So we've got just probably a couple minutes here if there are any questions. I know that we've just got a lot of general praise for the presentation in the chat group. It it was really a great of you to do this tonight, Dr. Labine. We really appreciate it. I think perhaps this would be a nice time just to close it off. There's a lot of information, and as I say, we've got a lot of praise here in the chat group here for the presentation tonight. Again, just to remind everyone that we are recording the webinar tonight, and we will be posting a link on our website, www.northernhearts.org. As well, I do invite you to join our Facebook group if you have the chance and if you're a user. So I think, again, Dr. Labine, thank you so much for everything tonight. And we're really appreciative and really enjoyed the presentation. So thank you.
It was my pleasure. Thanks for having me. And yeah, I wish you all a safe COVID experience.
Yes. I pass on that sentiment to all of our participants. So I think with that, we'll say good night to everyone. And thank you very much for joining the webinar. We look forward to putting a couple more of these on. So good night all. Thank you.